The stats will tell you that 80% of all blindness is either preventable or curable. And realizing this, a startup was born in South Africa to radically alter the chances of you going blind. This is the Moneymakers. I'm Bruce Whitfield. Tonight, I'm joined by Dr William Mapham. He is co-founder of Vula Mobile to talk about how an app can transform lives and actually raise funding. William, there's an old cartoon by Tony Grogan from the 1980s with an Eastern Cape farmer talking to an academic, and he says to him, "Are you a real doctor or just one of those things from Rhodes?" You're a medical doctor, right?
Yes, that's right. So I work in the ophthalmology department at Tygerberg Hospital in Cape Town.
Well, what is the status quo in terms of our eyesight? We hear these horror stories of particularly people in poor areas around the globe who suffer from things like cataracts, not knowing that they can be helped.
Yeah, so I mean, most of my experience has been in South Africa and in Swaziland. And in both the rural areas in South Africa and in Swaziland, many people are blind due to things like cataracts, which are preventable well, curable with a simple operation that takes about 20 minutes. So we've been looking for people like that. And the first idea for the Vula app came from Swaziland, and then it developed further in the Eastern Cape, and now in Cape Town it's being used. And basically it's used to identify people with poor vision or with eye emergencies and get them care as soon as possible.
In practical terms, I'm a community care worker in Vaba, for example. How do I utilize the app to get guidance as to what my patient is suffering from?
So essentially the app's got well, first of all, you have to register, so only health workers are allowed to use the app. There's a very simple eye test and a couple of questions that you fill in, as well as taking photographs of the eye. And with that amount of information, it's submitted to a specialist, preferably in your area, and then an appointment is made for you, or if it's an urgent case, then you're sent straight to the referral hospital where you get the surgery or medication you need.
Now, what sort of process is there in identifying who is the right kind of health worker in order to deal with information as sensitive as this? Because it's not quite life and death, but it is the difference between being sighted and not being sighted.
Yeah, so what we found is that, for example, in the Eastern Cape, the community health workers are using the app. In the Western Cape, it's more nurses and doctors. And what we've also found is kind of a downward flow of information. So although the patients come up to the referral hospital, often in discussion with the patient's information and with the primary healthcare workers, they're learning a lot. So for example, Elizabeth Tunnison, who's a nurse in Vredendal, became interested in ophthalmology and eye care through the app. And then she went on to do a diploma in eye care, and she actually won the award for the best nurse in ophthalmology this year, or last year. So we think it's facilitating a lot of teaching going down to primary healthcare levels.
I mean, that's ideal, isn't it? Because one considers the risks associated with making an online diagnosis. You take a photograph of my eye. The eye is a complicated instrument. Sometimes there can be marginal calls, surely.
Absolutely. But what we found is a lot of times people actually have their vision saved. So to give you two examples, there was a patient from Kailicha who looked absolutely normal, but her vision was decreased with the vision test on the app, which is not a normal case. So she was referred to Tygerberg, and we found out that she had a TB granuloma, which is a bad infection at the back of her eye. And we treated that and happened to restore her vision. Another case from Worcester, also quite a rural hospital near Cape Town. There was a child there who was hit by a stick. The doctor who saw the patient wasn't really sure if anything was wrong, but he sent a referral through anyway. And with a trained eye, we noticed that there was actually a laceration on the front of the eye. So again, it was an emergency case. The child was sent through, had an operation, and again had his vision saved. So we are seeing cases where it's making a huge impact.
Now, can it be adapted then beyond ophthalmology? Because surely one application like this could be utilized for other diagnoses.
No, absolutely. So we've been approached by a range of specialities. And next month we'll be launching with cardiology, orthopedics, burns, and then we're going to add other specialities like dermatology and HIV and TB this year as well, but it'll be later this year.
Does it require adaptation of the application? Because one would assume in a case like this, simplicity is absolutely key.
No, absolutely. So when we first started the eye test version of the app, it was actually quite complicated, and I wanted to have as much information as possible. But luckily, our director had a user experience company which he sold, and now works full-time for Vula. And she's really cut things down and made things very simple. And as you've pointed out, every speciality is very, very different. So each requires quite different forms and different information to make a good referral. And that's where I think we've become quite specialized in very different ways.
But would a healthcare worker, the healthcare worker in Kofimbaba, for example, be sitting with a range of 10 apps, everything from ophthalmology to dermatology to oncology, for example?
Yeah, so we've designed it so it's one app with multiple options for referrals. So rather than just having eye specialists on the app, it will have cardiologists and orthopedic surgeons and dermatologists and so on. So with one portal, you're able to access literally any specialist. That's our goal. And we kind of call it the specialist in your pocket.
Now, how does that relationship work then between somebody who's in a rural area? The odds are they don't have medical aid, yet we're fast-tracking people to access to medical specialists who are not renowned for giving away their services for nothing.
No, so all our specialists are currently within the public healthcare system. I spent most of my life in rural areas working within the public healthcare system, mostly in the Eastern Cape at Mudwileni Hospital. And there our real goal is to make the public health system work very, very well. And with the NHI coming in and the Minister of Health already trying to improve things, we think we can lend a hand and do our bit.
Now, how do you measure the impact of this kind of technological intervention in what was a far more cumbersome process previously?
Yeah, so as part of the specializing process, every doctor has to do what's called an M-Med or research on a particular topic. And I've done my M-Med on the Vula version or the eye version of Vula. And we've got another M-Med coming up on the orthopedic version as well. And there you measure things like not just how easy is it to use, but how quickly do you get hold of a specialist? Did it save time? Because you don't have to go through switchboards. You get directly put in touch with the specialist on call. And then also whether you can actually advise on treatment that actually happens on site, and then you save a lot of transport costs as well.
So how is it then facilitating better healthcare? Because one of the big issues in South Africa is the huge distances that people have to travel to get primary healthcare. Many can't afford it. Many are not in a position where maybe they're fit enough to travel, particularly in rural areas. So how is it facilitating care?
So it was quite a sort of personal journey, really, because when I was working in the Old Transkei, we found that I actually had no access to specialist knowledge or wisdom. So, for example, if a patient pitched up, we had to deal with it whether we knew what to do perfectly or whether we had to read a book. I think I read more in those couple of years than ever in my medical school training. But we really didn't have enough specialist kind of exposure, really. And so this is a way of actually putting specialist knowledge and wisdom directly in touch with the primary healthcare workers. And we aim to improve care not just on the ground, but also to get patients to referral hospitals and get them the definitive care they need if that's what they require.
When did you start?
So I guess the idea was back in 2011. That was in Swaziland. Then it developed in the Eastern Cape after that. And then it went live on both the Apple and Android app stores in July 2014.
And how many lives have you touched during that time?
Well, I think directly, I think it's about 1,500 so far. And this is just eye care, and it's still kind of a trial version. But we're seeing it ramp up now with contracts with, within the KwaZulu-Natal and with the Eastern Cape. And with the other specialties coming on board as well, I think we'll touch even more lives.
Is this a money-making venture, or is this something altruistic on your part?
Well, I guess it started off incredibly altruistic, but things have to become sustainable. And fortunately, there are quite a lot of people and organizations that want to improve healthcare, even in the public sector in South Africa. And we're slowly forming contracts with them and helping to keep things sustainable in a financial point of view. We've also been very fortunate in that we've entered a number of innovation competitions and been very lucky to win some of them. The most recent one was the African Entrepreneurship Award, which took place in Morocco, and that was an Africa-wide competition. We won one of the 6 top prizes, which was $150,000. Initially, the exchange rate at that time was 13.5. The exchange rate's gone up quite a bit now. So we've got a bit of an excess in our budget, which we can afford to hire a full-time researcher to really measure how much of an impact we're making.
But this is something that is sort of created for local conditions, but there are many societies on this planet that have got the same sort of demographic problems that we have, the same sort of geographical limitations that we have, and struggling health systems. It looks like something that's imminently exportable.
No, absolutely. So they've already tested it in New Zealand, for example. Not something that we expected, but it's just as easy for us to set up anywhere in the world as it is in South Africa. It's just an app. It's available on the app stores. People are able to download it. And we've got a possible contract coming up in Zambia, and we've had a number of downloads in other African countries. And I think once we translate it into French and to Spanish, we should spread into other developing countries as well.
Dr. William Mapham, it's a great innovation, and he's been very successful in terms of the public recognition and also state recognition that he's received for the application, which so far focuses primarily on ophthalmology, but there are plenty of opportunities to leverage it within the broader healthcare sector. Dr. William Mapham is the co-founder of Vula Mobile and full-time ophthalmologist as well. Thank you so much for coming in. Nice to see you, William. And thank you for watching. There'll be more Moneymakers tomorrow. Till then, bye-bye for now.